So I'm going to talk a little bit about MLD today. I did a clinical with a lymphedema therapist. So manual lymphatic drainage is part of the intensive phase of lymphedema treatment. So we're going to act like this is my patient and she is post-mastectomy. I'm just going to walk you through a little bit of the sequence. It's a 45-minute massage, so I'm just going to talk briefly about the basics of it. So to start out, I would come up here, right above her collarbone. We're going to start at the neck, and I'd be giving gentle strokes inward. I'd do each of these 5 times in every body part that I go to. The strokes are really light with the lymphedema massage. All you're trying to do is move the skin under your hand. So you want good hand contact everywhere you go. You're just trying to gently move the skin. Next, I would go to the central lymphatics, and I would be giving strokes inward toward her belly button in each quadrant. I would do each of these 5 times in each of the 4 quadrants. Then I would go to deep breathing. Deep breathing is really important so that we kind of stroke the thoracic duct with her diaphragm and get the fluid moving back up. So I'd ask her to take a big deep breath for me, and I'm giving just a little bit of pressure, and then have her breathe out, and then in again. And I would do this 5 times as well. And then, if she had had a lymph node removal here, then my goal is going to be to move the fluid away from that lymph node bed. So the next thing I would do is come to this side, and you open up this lymph node bed. I'd ideally be on the other side of the table. But opening up this lymph node bed, and then opening up this one down here, around her groin. And then the following strokes after that, there's a long sequence. You work all the way down to the fingers, but your goal is going to be, as you move the lymph up this extremity, then you reroute it to the other sides. So I'll show you an example here. I've opened up this lymph node bed. I'm going to want to move the lymph down to drain here. So the strokes are very light, and you're just moving the skin down. So that's a basic overview.